Josh, we were talking about the national health expenditures projections from the federal government. And, one of the issues that came up recently, and of course, it's a big part of federal healthcare spending, is Medicare prescription drugs. And back in 2022, there was a provision in the Inflation Reduction Act, which said that the government could start negotiating prices for prescription drugs with the drug companies, and that began to be implemented this year. So tell us about phase one of that. How is it going? Anything surprise you about that? And where do we go?
Yeah, so it's worth saying that two things happened at once in the Inflation Reduction Act. And this is actually something the Medicare actuaries talk about when projecting costs, is that Congress changed the prescription drug benefit in Part D of Medicare to, for the first time, have an out-of-pocket cap for beneficiaries. So no one in Medicare Part D is going to have to pay more than $2,000 out of pocket in any year for their prescription drugs. So just capping out-of-pocket costs is expensive, and Congress wanted to find a way to pay for that. So the way they devised are really two things. One, drugs are not going to be allowed to increase in their prices faster than the rate of inflation in the economy. So that will hold down drug spending to, in part, pay for this new out-of-pocket cap. And the other thing they're going to be able to do is negotiate the price of the kind of most used, most expensive drugs to lower drug prices throughout the decade and then beyond, to again help pay for this change in the Part D benefit. And also, in addition to that, it will reduce Medicare spending and the deficit. So the first 10 drugs were selected for negotiation, and the prices that were negotiated were just released. And these prices take effect in 2026. And then the following year, there will be another 15 drugs in Part D negotiated. And then after that, you're going to be able to negotiate 15 drugs in either Medicare Part D and Medicare Part B. So this is a really big change. When the Medicare prescription drug benefit was created, Medicare was forced to accept whatever prices the drug manufacturers wanted to set, and now they can do some negotiation. So what are the results? Well, I think the results were both as expected and a little bit underwhelming. Underwhelming from a sort of federal budget watchdog perspective, because it does seem like the administration could have negotiated a little harder and got prices down a little bit lower than they did. But I think it's also clear that they'll come close to hitting the targets that CBO expected when they projected about $100 billion in lower Medicare spending over the 10-year budget window from price negotiation. So this has also left pharmaceutical companies in sort of an unusual position where they've been telling their investors that they were pleasantly surprised with how the negotiations went. It wasn't going to harm their business much, but yet they're still fighting tooth and nail in Congress to eliminate these provisions and in the courts to declare the negotiations unconstitutional. So it's kind of a mixed bag. I think we're going to get the savings that were expected, but I do think there is room for, in the future, the administration to negotiate a little bit harder and lower prices a little bit more.
Is there any movement in Congress to expand the universe of drugs that would be subjected to negotiations?
Yeah, the Democrats in the House and Senate have a plan to speed up the negotiations, which just means having more drugs eligible. The Biden administration put that proposal in their budget, and it seems like the Vice President Harris is proposing to do something similar on the campaign trail. I think the interesting thing is when we're talking about these drugs, really the top 25 to 30 drugs that seniors take in Part D make up a really large percentage of our total spending in Part D. So the top 10 drugs that were just negotiated account for about 20% of all Part D drug spending. And The top 20 Part D drugs account for almost 30% of all Part D drug spending. And then in 2 years, when we're able to negotiate Medicare Part B drugs, which are the drugs that are given to you in doctors' offices through injections or infusions, the top 10 Part B drugs account for 40% of Part B spending. So really, once you get through the first 3 years of negotiation, you've really gotten a big chunk of your savings opportunities because those are the drugs that are most used and most expensive. So the real key is kind of getting these first 3 years, these first three phases of negotiation done in order to lock in the savings on the drugs that are most popular and most expensive.